Welcome to the Cannabis Enlightened podcast with Dr. Leroy Brady, brought to you by March and Ash and presented by IVC Media. I'm Chris Cantori, and it's my pleasure to introduce to you your host, Dr. Leroy Brady.
My name is Leroy Brady. I teach the business of cannabis on the campus of San Diego City College, and I am a PhD. Today, we're going to be talking with what I consider one of my very, very important and special guests. As I've been teaching the class, the business of cannabis, this person has been with me throughout all the classes. And I tell you what, I couldn't do the class unless she is with me. I'm going to have her introduce herself and talk about her background, something that she doesn't like to do very much, but I've told her that she can't leave the room unless she tells people who she is and what she does. And then we're going to talk about something that I think many of you are familiar with, the term that is used to refer to cannabis that is not so flattering. We're going to talk about the word marijuana, perhaps Mary Jane, weed. There are a number of slang terms that are used to describe cannabis. And we're going to talk about it and talk about the negative connotations of it and how people kind of stay away from cannabis because of those slang titles. So, without any further ado, I'm going to turn it over to our guest, who I believe now is a friend of mine. Is that correct?
Indeed.
Indeed. She says indeed. So I'm indeed a friend of Wendy. Wendy, welcome.
Thank you, Dr. Brady.
Leroy is fine.
Yes. So hi, I'm Wendy Wiehl, and I have my doctorate in clinical pharmacy, and I obtained that at the University of California, San Francisco. And during my fourth year of clinical rotations at the school, I had the opportunity to do some rotations at the Haight-Ashbury Free Clinic Drug Detoxification Center. And that's how I got into addiction medicine. And so I had 4 jobs when I lived in San Francisco because my rent was really expensive.
How much was the rent then, Wendy?
You know, honestly, it was about $1,200, but it was a million years ago. So,
well, that's kind of expensive now too, I think, a little bit, but okay.
I mean, compared to today, I don't know.
Oh, okay.
You know, but yeah.
You're right.
I had 4 jobs. One of my jobs was teaching pharmacology in an addiction studies program in the Bay Area. And so when I moved down to San Diego, there weren't a lot of opportunities to do clinical work in addiction medicine for pharmacists. So I ended up teaching at San Diego City College. I was lucky to get hired there, teaching pharmacology. And over the years, that segued into a full-time position. So I'm a professor of addiction studies at San Diego City College. I'm also department chair of the behavioral sciences department, and fortunate to be invited to do the cannabis pharmacology lecture in your cannabis business class.
Fortunate. This is a very, very humble lady.
Thank you.
You're welcome. So, Wendy, 4 jobs when you were...
Yeah.
4 jobs?
4, yeah.
Now, I dealt with 2 or 3, but 4, what were the 4 jobs that you had?
Well, you know, working at the Haight-Ashbury was a free clinic, right? So we didn't make a lot of money.
Okay.
We were all there doing passionate work, not work to, make a bunch of money. So I didn't get paid for a pharmacist compared to other pharmacists that my colleagues.
Okay.
But I loved it. It was wonderful work. I mean, I worked with some incredible people who, all hearts on their sleeves, super passionate about what they're doing, but also the clients. Like, it was such a good education for me. I didn't really know that much about addiction when I got the job there. And people with addictions are just like everybody else. In fact, maybe they might be the best and the brightest of everybody else. It's an interesting fact. And it was a great education for me to learn about how I think society has a view of people with addictions as being lowlifes or losers or whatever, and it's certainly not true at all.
That's until they become their daughter or their son or nephew or husband or wife.
Well, I think there's a lot of misunderstanding about addiction, and certainly when I started working there, I really was ignorant about it, and I think I just think people don't understand. People will say, "Oh, you lost your kids, or you lost your house, or you lost your job. Why don't you just quit?" And it's much more complicated than that. It's all about the survival mechanisms of the brain, right? The reward circuitry of the brain. When we eat food when we're hungry, we get activation of dopamine reward circuitry, and that encourages us to repeat the behavior, and that's for survival. Same thing, you're thirsty, you drink water. And all drugs of abuse, including cannabis, but to a lesser extent than other drugs, activate reward circuitry. And so the brain actually thinks that the drug is required for survival, right? It's not. We're talking. I'm a scientist. We're talking about cellular brain, neurons. This isn't. Neurons aren't good or bad or strong or weak or anything like that.
They just are.
Yeah.
Okay.
Yeah. So, the thing that I learned working at Haight-Ashbury Detox was not to judge people so harshly, And it changed my life working there, really.
Because they are addicted. Not to judge them because they're addicted.
Correct.
Okay.
Or think that they're bad people because they're addicted. They're not.
Right.
They're not.
Okay.
Drugs alter the brain to a point where they make people make bad choices. They're not bad people. They're people who are making bad choices because the drugs are interfering with the brain's ability to make a good choice.
Some of the people I've come across make bad choices without any drugs. They just make bad. And I can think in my life I've made bad choices without anything. I just made a bad choice. So you're absolutely right.
Yeah.
You made me think about, I don't want to get too political, but Nancy Reagan one time had this slogan going, "Just say no."
Ridiculous.
And I think I wrote about, how just say no can keep us safe. It's not that easy.
It's ignorant.
Yeah.
Yeah. It's the whole thing, like, this is your brain on drugs, the scrambled egg in the pan, all the government propaganda. It's yeah.
Yeah. And people believe it.
Correct.
They believe it.
Correct.
And they run with it. And these are their marching orders. You're addicted. You're a bad person. You should be able to just say no. You should be able to quit just tomorrow, today.
Right.
You can just stop. And it's just not that easy.
Yep.
So, Wendy, what is your thought? What are your thoughts on how we talk about cannabis? And I'll use it because we're talking about it now, but none of us like using the word marijuana when we talk about cannabis. And from your standpoint, why don't you like the word marijuana?
Well, when I first started teaching pharmacology, it was 1992, and I used the term marijuana all the time in my lectures, in my exams, everything. The term marijuana, and then I read something about the history of the war on drugs and how really the war on drugs started with the end of Prohibition, and that was because the cops who were the head of the Bureau of Alcohol Control were all going to be out of jobs. Good
old Harry.
So Harry Anslinger was the head of the Bureau. And this is what eventually became the DEA, right? Mm-hmm. So he was going to be out of a job, and all of his cronies were all going to be out of a job. And so he had to go after something else, right, to justify his position. And at the time, there were a lot of Mexican immigrants, farm workers, who were using cannabis and, quote unquote, taking away jobs from the white folks. And so this was sort of like killing two birds with one stone, right? And then also the jazz musician scene, the whole jazz scene was mostly African-American musicians who were also using cannabis. So the Mexican immigrants were using cannabis, the African-American jazz musicians were using cannabis, and he decided to go after cannabis and equate cannabis with violence. And this was his propagandistic campaign again, to justify his position, but to also take away the civil liberties of people of color, right? Now, at the time, cannabis sativa was listed in the U.S. Pharmacopoeia as a medicine, right? The American people were used to it as being used for medicine.
So now you're talking about it was legitimate.
Yep.
It was legal.
Oh, yeah.
It was okay.
Oh, yeah.
People could take it. And it worked.
As medicine.
As medicine.
For sure. Yeah.
Just like Tylenol or Advil today or Bear aspirin.
But
better. Better. Okay.
Yeah.
So it has a history of being legit,
for sure,
medicine, and worked.
Yep.
Okay.
Yeah. So he knew that the American people would not buy into his propaganda if he used the term cannabis, because in their minds, cannabis meant medicine. That was their association with the word. Words matter,
Absolutely.
right? Words matter. So he adopted the term marijuana, which at the time was actually a Mexican slang term for cheap tobacco. All right, so he knew that most Americans probably weren't familiar with the term, and that they would be, it's an exotic term, marijuana, what is that? And, the whole reefer madness, crazy, homicidal insanity, I think is the term they use in the film, right? So he's the one who's been credited with really adopting it in the United States, and really just to sway public opinion. Right. So in my mind, the term marijuana has its roots in racism, and I'm uncomfortable with propagating that. Right. So once I learned all of this, I had to retrain my brain, because you get used to using the term marijuana. I had to retrain my brain to change all my lecture slides and my notes, my exams, right, everything. And also I started educating my students about it. It's like, if racism matters to you, maybe don't use this term. Now, I know not everybody agrees. This is my personal opinion.
Sure.
And I know not everybody agrees that marijuana is a racist term. But if you examine the history, you see that's where its roots lie.
So what's been the reaction from your standpoint, to changing from marijuana to cannabis? How have people responded to that?
Most people, I think, agree, and see. And also, I'm a scientist. Why are we not using scientific terms? Cannabis sativa is the botanical term for the plant. Why are we not calling it that? Just from a scientific standpoint. But I think my students, they appreciate learning this, because I think most people don't know about that history. And I think they like learning about it and being aware.
Do you also think or feel that using the term marijuana has this shock value that it causes people to, I guess, look around and say, "Oh, okay, and I'm going to pay attention to what you're saying because you said marijuana as opposed to cannabis"?
Perhaps. I think as an educator, it pains me to think that there's a lot of uneducated people out there, but I think that is the case. I mean, there's a lot of uneducated people who would equate cannabis with heroin or methamphetamine, and right, drugs that cause real harm. Right, and I recognize that there's a percentage of people who actually do develop cannabis use disorder and do have problems with it. I'm not trying to minimize that, but we certainly know that it's to a lesser degree than some of these other drugs that we're struggling with right now in the United States, heroin and the opioids, fentanyl, and certainly west of the Mississippi, we're really struggling with methamphetamine right now. Recently I read that methamphetamine overdoses have risen 30% in the last year. It's yeah. So I think some people equate because of the Schedule I status, right? The feds have banned, if a drug is placed in Schedule I, it means it has no therapeutic value and very, very high abuse potential, right? And so cannabis is placed in Schedule I status by the Drug Enforcement Agency, right? And so the feds are basically telling the public that cannabis is equally dangerous as heroin. And I mean, we just know that that's not true.
So can you talk for a minute about, you used the term Schedule 1.
Mm-hmm.
Can you talk for a minute about, well, what is this schedule? What is this thing? And what is this? What value does it have in life, in the medical community, political community? What's the deal with being on a schedule?
So in 1970, the Controlled Substances Act was passed, and it was to ban certain drugs, but to also place them in the schedule. So, and these are, numerical Schedule 1, Schedule 2, Schedule 3. And so basically any drug that's placed in Schedule 1 is considered to have no therapeutic value. We can't use it in medicine. And it has a very high abuse potential. Schedule 2 is still considered to be high abuse potential, but they recognize a therapeutic value. So for instance, the feds consider cannabis to be highly addictive, which it is not, right? And to have no therapeutic value, which it has myriad therapeutic value, right? And cocaine is Schedule 2 because it has a therapeutic value. It's a local anesthetic, but it also is highly addictive, right? So they're saying that cocaine has therapeutic value, but cannabis doesn't. I mean, it makes no sense. But remember, the DEA are not scientists; they're cops, right? So their perspective is shifted.
So it sounds like it could be a little bit political too.
I suppose I'm making it that way.
Well, I mean, if one cocaine, I would think that you'd rather have someone take cannabis than cocaine.
Well, they have different uses.
Okay.
I mean, right now there's movement, right, to change the scheduling of cannabis, right? It never should have been placed in Schedule 1. It's ridiculous because, like I said, it does have therapeutic value. But if you, there was a study done several years ago that compared the addictive potential for certain drugs, right? And like out of 100 people, 32 of them are going to become addicted to nicotine if they ingest nicotine for the first time, right? So a third of people who ingest nicotine will become addicted, right? That's a high number, right? Contrast that with 100 people all ingest cannabis, only 9% of them are going to become dependent, right? So much less addictive than even nicotine, which is a legal drug, right? So...
Well, that's pretty astounding.
Yeah.
Why do you think that is? I mean, why would more people be addicted to nicotine than to cannabis?
Well, because of the effects on the reward circuitry of the brain, right? So how reinforcing a drug is what makes it addictive, right? So cannabis, it activates reward circuitry for sure, but to a lesser degree than even alcohol and certainly tobacco. So to put it in Schedule 1 is ridiculous because it's not as addictive as even drugs that they've placed in Schedule 2. And again, not based in science, right? And then in terms of therapeutic potential, cocaine only has one therapeutic use. It is a local anesthetic. It's used in hospitals. It's used in eye surgery. It's, there's a few ways that it's used, but only one therapeutic application, local anesthetic. Where cannabis... I mean, we've got several that have been scientifically proven and a lot that haven't been scientifically proven. And part of that has to do with the fact that it is a Schedule 1 drug. The government has banned it, and therefore it is almost impossible for scientists to do legitimate research on it. So, it's this conundrum. We're like stuck. We know there's therapeutic potential, but we can't prove it by doing research because the government says you can't.
Because it's a Schedule 1 drug.
Exactly.
So the thing from a governmental standpoint that makes it a no-no is the same thing that prevents further research into it to find out what it is good for.
Precisely.
Or some of us know what it is good for, but what more it could be good for.
Precisely.
Is that the right way to term it?
Yeah. I mean, there's some science that shows that cannabis can prevent tumor growth.
Oh, my.
Like treating cancer.
Wow.
I mean, I'm not saying that cannabis can do that. I'm saying, why aren't we investigating this? Like we should be taking this more seriously and investigating. And, there is research being done. I mean, I want to be clear that the government allows some research to be done, but it's extremely limited, and you've got to go through jump through a lot of hoops and a lot of bureaucratic red tape to get to be allowed to do the research. And so what's happened is a lot of the research that's being done is by using people who subjects in studies who are using their own cannabis, which we're not controlling for. What's the percentage of THC in the cannabis? There's no control over that. These are people who are self-reporting use, and then we're studying them. So that's not good science, right? Or we're using synthetic cannabinoids and studying them and trying to apply that to the phytocannabinoids, and that's not good science either. They're very different.
So what's the synthetic? What do you when you say
it's
synthetic?
Like Spice, K2, these products where J.W. Huffman was he's a researcher who, because again of the government restrictions, wanted to study cannabinoids, and so he started creating his own synthetic cannabinoids in a lab, right? Because he's just trying to study them. They were never meant for human consumption, right? So he's trying to study them and learn more about cannabinoids and the endocannabinoid system and all of that. So street chemists, people who manufacture drugs for recreational use and for sales, right, to make money, mine the scientific literature to find stuff that legitimate scientists are doing, right? And so they figured out how to make the synthetic cannabinoids that J.W. Huffman created in his lab. Again, never meant for human consumption. They created them, and it's a chemical that they spray on plant material, and then they sell it. You can get this at convenience stores, paraphernalia stores, and they're labeled incense, or it's like wink, wink. This is actually something that you're going to smoke. And now, because they're synthetic, they act differently in the brain than the phytocannabinoids, and so we're seeing all kinds of these adverse, like kidney failure, even some deaths are being that we think that were probably due to the synthetic cannabinoids that you don't see with the phytocannabinoids because they're acting differently in the brain, right?
When people buy this synthetic cannabis, can I say cannabis or THC? It's synthetic.
It's
what?
No, it's synthetic cannabinoids,
okay.
right?
So let's back up. What is a cannabinoid?
Yeah. Okay,
what are we talking about?
Yeah, okay, perfect. So in chemistry, molecules with similar structure are placed in families, right? So you have like the opioid family that includes heroin and fentanyl and hydrocodone, et cetera, right? Or the benzodiazepine family that includes Xanax and Ativan, et cetera. So we have these molecules placed in these families because they have similar molecular structures, right? And in the cannabis plant, there's about 100 different cannabinoids. Now, we don't know a lot about all of them, right? We know most about delta-9 THC, right? Tetrahydrocannabinol, because it's been the most studied. And we're learning more about cannabidiol and some of these other ones. But there's 100. Now THC is obviously psychoactive, right? And a lot of them are not psychoactive, meaning they don't get into the brain and cause effects in the brain. But there's a lot of cannabinoids in the plant. So they have similar molecular structures, but they're not identical, right? So you've got 100 different cannabinoids in the plant. And then in a lab, they can creating a molecule that has a similar structure to the ones found in the plant. So they're cannabinoids based on their structure, but they're not exactly the same. Now, they did create synthetic THC, right? In the 80s, I forget the exact year, 84, 85, somewhere around there. Dronabinol, right? Or Marinol is the trade name. That's synthetic THC. So they copied the structure of it. It's exactly the same molecule, but it's synthesized in a lab. Now, the problem with a medication like that, and also let me point out the issue here. In the 80s, remember that the plant cannabis is Schedule 1, illegal, banned, no therapeutic value. But in the 80s, the FDA approves a synthetic version of it and says it works as medicine, right? Like, that's just illogical. It's totally illogical.
And that stuff would kill you.
Dronabinol, no.
The synthetic?
Okay, so dronabinol won't, but
Okay.
some of these newer ones,
Okay.
yes, for sure, right? So the issue with dronabinol is when it first came on the market, it was marketed to, people who were going through chemotherapy for severe nausea and vomiting, right? And when you ingest just the straight THC without which we know now that the protective effects of CBD. So CBD in the plant, CBD really counteracts some of the adverse psychological reactions that THC may cause, right? So it's really good to have a balance of THC with some CBD in there. When you isolate just the THC and give that to people started having really bad adverse psychological reactions from it. And, these are people who are sick, and they're like, this stuff doesn't help me at all. I don't want this. And so there wasn't really a lot of public buy-in to dronabinol when they approved it in the 80s, because people would rather just ingest the plant, right? They felt better with the plant. So cannabinoids, there's a whole lot of different molecules that do different things, and some of them complement each other.
Now, you said something that's very interesting, and I would think important for our listeners, because a lot of people feel like I've either got to do THC or CBD or some other form of cannabis. But you talked about a balance, and that the balance is better for you than perhaps maybe taking one or the other. Is that true? Is that beneficial?
Well, okay, so CBD has its own therapeutic applications, right? So CBD is great for inflammation, and CBD is not acting in the central nervous system. So you're not getting high from CBD, right? So there's a lot of people, I think there's a lot of people that don't appreciate the intoxicating effects of cannabis, right? But might want to take advantage of the therapeutic applications of CBD. So CBD will not get you high, but can reduce inflammation and reduce anxiety. There's a lot of therapeutic applications for CBD in and of itself, right? So I appreciate that. Now, there's some issues with CBD formulations. It's not well absorbed. It doesn't cross into the blood-brain barrier very easily. So some of the products are better than others. So I always tell people, because CBD products are not regulated, meaning that there is no government agency they have to report to, buyer beware, but read product reviews. Like, look at what other people are saying about this product when you're selecting a CBD product, right? Mm-hmm. So I appreciate there's people who might want to get the benefits of the cannabinoids without getting high, right? Mm-hmm. In terms of, THC has different therapeutic applications, and again, we're just learning really what all of those are, right? But THC has different. It's good for other things, and CBD is good for other, right? So different therapeutic applications. The issue with over the decades, right, as I'm sure you're aware, right, in the 60s, the cannabis that was available had about 3% THC in it, right? And then people started with the different growing techniques, right, manipulating the level of THC, the cloning and all of that. So to drive up the THC level in the plant, and subsequently a lot of times they drive down the CBD, right? And the problem with that is when you get really, really high THC and really, really low CBD, it's more likely to cause, the anxiety and panic attacks and the paranoia and those. And what we've learned is that if you've got some CBD in there, it's protective against those. So you're less likely to have those kinds of adverse symptoms, right? So, I think that's been a bit of the problem with the industry is really always trying to drive the THC up as high as possible without recognizing that, CBD in there, it's good.
Are you seeing that maybe more CBD is attractive to people from a medicine standpoint than the THC?
I don't think so. Not necessarily, because again, I think THC in and of itself has a lot of therapeutic applications. And you know what? Honestly, the plant itself probably has a lot of therapeutic applications as opposed to just THC or CBD, because there's all these other cannabinoids in there that when people are just ingesting plant and getting therapeutic value from that, we don't actually, well, which cannabinoid is important for that? Or is it the combination of them, right? And isolating one or the other might not be the best approach, right?
So it sounds like what you're saying is if we just talk about THC and CBD, we're missing a lot.
I think so.
Now, that's a great place for us to take a quick break, but don't go anywhere, because when we come back, we'll have more with our guest and Dr. Leroy. You're listening to the Cannabis Enlightened podcast, powered by March and Ash.
Hi, I'm Olivia. I'm 13 and I've been vaccinated. The best part of being vaccinated is I can play soccer again. And I get to go back to school. I didn't really like Zoom. And I can hang out with friends and family. Thanks, Mom and Dad, for helping me get the vaccine. It feels great to get back to normal and to keep other people safe. I really hope everyone gets vaccinated. And guess what? It didn't hurt a bit.
Do you have a business, nonprofit, or campaign that needs to break through the communications clutter? For over 10 years, IVC Media has developed a suite of digital tools, data sets, and creative techniques. Our teams in San Diego and Tijuana can help you overcome the most challenging communications projects in any language or location. Visit us today at ivc.media.
Welcome back to the Cannabis Enlightened podcast. I'm Chris Cantori, and here's more from our host, Dr. Leroy Brady.
If we're just using marijuana, we're really missing the boat. If we talk about cannabis, we open it up more. If we talk about flower, then we're appreciating everything there is about the medicine as opposed to looking at it as a drug. Or do you see it the same way?
I do. I mean, I'm a scientist and I'm a pharmacist, right? So, I mean, as a pharmacist, I do believe in better living through chemistry, right? I mean, chemicals can be used for good or they can be used for evil, right? I'm being flip, but I appreciate medicine. And as a scientist, right, I see the plant as to be honest with you, I see it as a treasure trove of medicinal applications that could make the world better, right? Like, why are we not taking advantage of something that could help ease suffering? Like, I don't get that.
Yeah. Okay, that's a good point for us to talk about for maybe a few minutes, that part of the reason why we're not doing that, obviously, is the schedule
right.
that you talked about a few minutes ago. You did a great job of explaining that. But is another reason the way we characterize or that we label cannabis? If we continue to say marijuana, do we continue to distance it from the masses?
I think so.
People are saying, I don't want to try that because it's marijuana.
Right.
And if you try to tell them,
right.
this is cannabis.
Right. Well, that's the irony here, right, Leroy? Because back in the late 1800s, early 1900s, when a person heard the word cannabis, they thought of medicine.
Yes.
Right? And now here we are, and we've got the term marijuana, and people think of it as bad, illegal drug, bad for you, right? And so I'm so glad you pointed that out, because, like, in my mind, we need to get back to where the association cannabis is associated with medicine or improving health rather than destroying health, right?
So
that's good.
I have talked to people about that have ailments, joints or whatever, and I say, if I tell them that it's I have some salve and it's marijuana, they'll say, no, I don't want to get high.
Of course.
That's where they immediately go.
Yeah.
But if I say I have some salve and it's going to relieve your pain, and they'll say, well, what is it? I said, it has cannabis in it. They'll say, okay, well, I'll try it.
Words matter.
Yes, exactly. I believe that. Words matter. And as long as we continue to use the word marijuana, we're going to have that stigma. and it's going to drive people away from it.
Agreed.
Now, you've talked about earlier how in your teaching, once you did the research, you changed everything, that you washed out the word marijuana from everything that you're doing. How might people do that on an everyday basis?
I mean, change is hard for people, right? I mean, we humans, we don't like change that much. And I just think, it's just making a commitment to trying, right? Like, I'm not perfect. When I first started trying to change the way I talked about it, I would slip up and I'd correct myself. It's like right now I'm trying to not say you guys all the time. I'm trying to say you folks. And I still slip up and say you guys sometimes. It's a process, right? Yeah. It's a process. I think it has to do with your motivation. Like, does this matter to you? If it doesn't matter to you, keep calling it marijuana. I don't know. I mean, again, it's my personal opinion, but I think if it matters to you and if you recognize that the term does lie in racist roots, and if you care about ending racism, which,
I would hope everybody.
Right. I mean,
yeah, well, everybody right. that I know.
Yeah, same.
And everybody that you know want to end it.
Yeah.
Yes.
So I just think, if you've got the commitment to that, and, it's a process. You dedicate, commit to it. Just try to start changing how you talk about it. And I think you're right. As long as we continue using these terms that are, and look, let's not even talk about racism for a minute. Let's just talk about government propaganda, right? Like, if the term is associated with propagandistic reasons, right, then that's going to be the association in people's minds is based on this propaganda. So I feel like let's just even get rid of that, right? So
what is the reaction that your students have to that? Because I'll make an assumption that they say never do it. I'll make an assumption that the students that come into your class know about cannabis as marijuana.
Yeah, they do. That's true.
How do they react to this change?
My students are woke.
Okay.
I mean, they are, and because addiction knows no boundaries, right? So when a lot of my students are in recovery, not all of them, but a lot of my students are in recovery. Now, when you get into drug treatment, right? You get into treatment, there's no boundaries, right? Gender, race, socioeconomic status, they're all there. And from my experience, what happens is they all become very tolerant and what's the word I'm looking for? Open. They're not judgmental people, I guess is the word, right? Okay. So I feel like when they get into my and because they're not all of them, but again, a lot of them are in recovery. They're passionate about what they're learning about, so they're all sponges. So it makes my job easy. They're easy to teach, right? They're into it. They're passionate about it. And I feel like because they're not, and they strive to not be judgmental people, because if you're going to become, most of my students are taking these classes to become substance use disorder counselors, right? You can't do that line of work and be judgmental, right? And so they're not, or else they wouldn't even be interested in the field, because it's certainly not the giant dollars that are bringing them there, right? They're passionate about it. They want to help people. It's a beautiful thing, beautiful. And they're not judgmental, right? And so when I explain to them the roots of the term, they agree. They don't want to continue using the term marijuana either. Now, they have seen the consequences of addiction, and addiction treatment it grew out of the 12-step model, which preaches total abstinence, right? So many of them probably would not be super stoked about recreational use of cannabis, and I get that. I totally get that. But I think they are certainly open to understanding like therapeutic values of the plant, right?
That's interesting.
And I'm speaking for my students. Like,
sure.
I shouldn't be speaking for my students,
Well,
but
from a general standpoint, you're talking. Okay. It's interesting that you said they wouldn't be in favor of cannabis from a recreational standpoint. I wonder how many of them partake in happy hour.
No. If they're in recovery, they're not doing anything.
You're talking about recovery, people in recovery.
Total
Okay.
So the total abstinence approach means you shouldn't be using anything that alters your mind.
Okay.
Right. That's the thing. And I mean that comes that's their perspective because of their experiences, which are valid, right? Okay. And I respect that.
Okay. Do you work with groups that aren't in recovery?
Some of my students aren't in recovery, but I will say this. Most people who are drawn to the field of substance use disorder counseling are drawn to it because they're either in recovery, and if they're not in recovery, they're drawn to it because of some personal, like a family member is struggling with addiction or, right? So they're oftentimes they've been, I mean, honestly, like if you look around, most of us have been touched in some way by addiction, right? Sadly, right? But that's just the world that we live in right now. So
how much easier would it be? I guess I want to say for you, or maybe I can open it up. How much easier would it be to, in general, I hate to say the world, but I'm going to say for the world, if we started saying cannabis as opposed to marijuana? How much easier would it be for the acceptance of the flower into the hearts and minds of people?
Yeah, I mean, I really do think so. You know, you and I agree on this. Again, I think it's better to separate the propaganda from the plant itself, right? And embrace it as, you know, a potential medicine. I mean, it is a medicine, right? But I think we could be taking advantage of it more than we are now in terms of therapeutic application and really easing suffering, right? And I think just the association of scientific term with it and removing the propaganda ties would go a long way in that.
Let me ask this. Do you feel or think or know that wider use of cannabis would replace a lot of the opioids that are detrimental?
Such a good question. Actually, yes. So in Colorado, right after they passed their rec law, I think it was 2012. I'm terrible with dates. I always hated history in school. But anyway,
a scientist is bad with dates.
I'm bad with dates. Oh my God. Right after they passed it, right? They looked at the incidence of opioid use in Colorado. So that went down. Mm-hmm. So the rec laws, so passing recreational cannabis laws in Colorado had a direct effect in reducing overall opioid consumption. Mm. And it's interesting because, cannabis can be used to treat pain.
Yes.
Right. And obviously it's less dangerous than the opioids in terms of pain management, right? Much safer alternative to pain management. And so, yeah, I mean, it's had a direct effect in reducing the incidence of opioid use, for sure. And I mean, we've got an opioid epidemic in the nation, right? So we should be looking at alternative treatments for pain.
And I'm probably going to ask a question that I already know the answer to. And the reason that we don't is financial, political.
Well, opioids, heroin is a Schedule I drug, but morphine is a Schedule II drug. Another thing that makes zero sense in terms of placing schedule, because heroin is diacetyl morphine. It has two acetyl groups attached to the morphine molecule. They're so close in chemical structure, right? And in terms of how they affect the brain, it's the same. Now, heroin, of course, is a little bit more addictive than morphine. I mean, it's more addictive, but they're doing the same thing in the brain, and one is banned and one is medicine. It doesn't make a lot of sense, right? I'm encouraged. I'm optimistic that I mean, there's a lot of pressure on the feds to remove cannabis from Schedule 1 and place it in, another schedule where it's recognized to have therapeutic value. So I'm optimistic that that's going to happen. And I think that's going to be the first step to changing things, right? Because as soon as they change the scheduling, more research can be done, right? And I mean, if you've looked over the last few decades, like how many states have passed the medicinal laws as well as the rec laws, right? It's most states now allow for at least medicinal, if not rec, right? So there's only a few states that completely ban it. So there's this huge movement, right? And really, California, even though we weren't the first to pass the rec law, we were the first to pass the medicinal law, right? Back in 1996, we were on the forefront, right? And so, I never thought in my lifetime I would ever see cannabis legal, and here we are, right? So. I have been accused of wearing rose-colored glasses, and I am a child of the Haight-Ashbury, right? So I'm optimistic that things are going to change. Things have changed. Things are changing, right? So, but I feel like we've got to get it out of Schedule 1. That's the huge hurdle right now, but there is movement in that direction. So we remove it from Schedule 1. That opens up research. We can find out more, like what is it about this plant that can really help people.
So now we may be on opposite sides of this. You want to remove it from Schedule 1 to another schedule. I want to remove it altogether from a schedule. I don't want it to be a Schedule 2, 3. It has, from my research and personal opinion, it is medicine just like Bayer aspirin. And Bayer aspirin is not on a schedule.
We're not on different sides of this. Okay. I do agree with you. I'm just thinking about like what's feasible our government, right? Our government's not going to go from Schedule 1 to over the counter. Like they just aren't, right? Baby steps.
I might agree with you.
Yeah.
Okay.
But I mean, also when you think about it, like the fact that alcohol is a legal drug, right? Like when I lecture in my pharmacology class about the adverse effects of alcohol, all my students get carpal tunnel syndrome from writing. Like there's so many adverse effects associated with alcohol. It affects your entire body, head to toe. There's adverse effects, right? It's astounding. And yet this is a legal drug. And then we've got cannabis that is a banned drug that not only doesn't have those kinds of adverse effects, it's actually therapeutically beneficial, right?
Healing.
And we can't say that about alcohol. Alcohol doesn't have any therapeutic value whatsoever, right? And so these things don't make sense, and it's politics, and certainly it's money. I mean, right? They make a lot of money, and they have a lot of political clout.
The political clout
This is
astounding. I'm trying to do, I'm doing a research on the amount of money that states collect from alcohol as opposed to cannabis.
Interesting.
And all the states that have recreational cannabis are collecting I'm going to say millions, hundreds of millions of dollars. As a matter of fact, a couple of the states, California and Washington State, are into the billions of dollars that they collect from.
No joke.
And that's amazing. I haven't done a comparison with the alcohol, but I'm going to do that next.
I would love to see what you find.
However, I can tell you this: there have been a lot of people that have died from DUIs, getting bad alcohol, anything connected with alcohol. They perished from, lost their lives.
Yeah. Strokes, heart attacks, cancer, the list goes on.
I have not read any overdose from cannabis.
It's impossible.
Well, you can die. I was thinking about this earlier. You can die from cannabis if someone drops 3 or 4 tons of cannabis on your head. Now, you can die from that.
Agreed.
That will hurt
Agreed.
you. Yeah,
Agreed.
yeah. But seriously, consuming it, you're absolutely right. Consuming it, you may have maybe some anxiety. You may start eating everything that's in your kitchen, but you're not going to die.
Right.
You're not going to die.
And not to minimize the adverse effects, because panic attacks are very real, and we have seen over the last few decades with the rising percentage of THC in plant that we have seen arising emergency room visits due to panic attacks, right? That's, and I don't want to minimize that by any means, but in terms of, fatal reactions, we're not going to see, there is no, the science has been done so far, they can't even establish what would be a fatal dose in animal studies, right? So the therapeutic index is the difference between the effective dose, like how much of the drug you need to do what you want it to do, and the lethal dose, how much of it would kill you, right? And like, for instance, we consider it's virtually impossible to overdose on a benzodiazepine unless you combine it with another drug, or specifically alcohol most of the time, right? And that's because the therapeutic index is 700 to 1, right? So it would take 700 times the effective dose to cause a lethal dose in somebody. And again, that's without alcohol. We think the therapeutic index, based on animal models, for cannabis is like 10 to 40,000 times the effective dose. It's impossible. No one's ever going to overdose on. No human will ever overdose on cannabis. It's impossible. Now, when Colorado first passed their rec law, there was a story in the media frenzy, because this person ingested some edibles, and you've been hearing about, like, there's edibles that are created. You're supposed to eat 1/10 of this brownie, right? And this person over ingested edibles, right, and jumped off of a balcony to his death. Right. And so the media was portraying that as a cannabis overdose. Yeah. Now, that's not an overdose. That's a tragic consequence of him over ingesting it. But it would be like saying a person who was driving while intoxicated on alcohol drove their car into a tree, and we're calling that an alcohol overdose. It's not the same. Right. Mm-hmm. So, no, there is no overdose.
So can we talk a minute about that anxiety effect from maybe consuming a little bit too much cannabis? Or THC,
right.
Okay? Because you're not going to get that reaction if you consume too much CBD.
Correct.
Okay? So what might a person do if they start to feel anxiety? Can you talk about that?
Yeah, for sure. That's a great question. So all of the hallucinogens, the psychedelic drugs, and cannabis, which cannabis is not considered a psychedelic. These are different drugs, different categories. But all of these drugs are what we call set and setting dependent drugs. So set is the individual who's ingesting the drug, right? And that includes your physiology, your neurochemistry, your biology, all of that, but also your personality, the mood that you're in at the time of drug ingestion. And then the setting is the environment that the person is in when they're using the drug. And that includes, other people, stimuli, lights, music, sound, whatever, right? So these drugs are the effects, the symptoms of intoxication, the effects are very dependent on the set and the setting. So the good news about that is if you change set or setting, which you oftentimes can do, you can change the effects of the drug, right? So like, for instance, if let's say a person dropped acid and they're having a bad trip, right? One approach to managing that is to try to change the set and setting. Now, your physiology, your neurochemistry, you can't change any of that, right? But the mood you can change, and the setting you can change. And so, that's an approach. When I was at the Haight-Ashbury Free Clinics Detox, that was something that they had they'd come up with this approach called the talk down method, which now I think most people are calling it the talk through method, to try to help people through difficult psychological reactions to drug intoxication, right? And a lot of that is minimizing stimuli, reassuring people, non-threatening body posture, right? You don't want to be like standing over someone, hey, you're okay, like non-threatening body posture, reducing stimuli, constant reassurance, those kinds of things. Like if another person is around when a person's having a difficult psychological reaction, sometimes you just talk them through it, right? If a person was on their own having anxiety related to that, honestly, like one of the simplest things is changing your breathing pattern, right? So if you breathe in to like a count of 4 and then breathe out to a count of 6, it actually starts slowing down your parasympathetic nervous system and just like slowing your heart rate down. is, one of the things with especially high THC cannabis is it does cause your heart rate to go up, right? And so people will start having feeling palpitations, like having the presence of this pounding heart. And especially in people who are new to cannabis, who don't have a lot of experience, they're like, oh my God, what's wrong with my heart? Something's wrong with my heart, which then causes more anxiety. And then that drives the anxiety up anymore. And then it can turn into panic, right? And so like I think, first of all, just having knowledge about it, like, hey, your heart rate's probably going to go up. It's not harmful. You're going to be fine. And then teaching people how to do these like breathing techniques and, drinking some water. Just you can turn that down. It's possible. Like there's going to be such situations where people are going to have to go to the emergency room to be medicated because they're not going to be able to do it on their own. That happens, right? But I think again through educating people and especially being smart about the consumption of edibles, right?
Well, let's talk about that for just a second.
Yeah.
So, because every person's human body is going to react differently. Mine would act differently than yours. Would you say it's a good idea to be conservative as you ingest any product that has THC in it?
Oh, for sure. For sure. And the thing about edibles is, I know there's these fast acting edibles now, but they're not all what they seem in my experience. But there's a delay in the onset of effects when somebody ingests an edible, right? Because it's got to go through the gastrointestinal tract and get the THC has to get absorbed by the capillaries in the small intestine and get into the bloodstream. It takes time. So when somebody eats something with THC in it, it's going to take 45 minutes before they experience any onset. And so some people are like, oh, I'm not feeling anything. I'm going to eat more, right? So people who are using edibles need to be patient. First off, right, and recognize that you're not going to feel like when you're inhaling cannabis, the effects are within seconds, right? So, people need to be educated about. First of all, you need to be patient because the onset's going to be slower, and being judicious about the dose for sure.
A lot slower than it would be if you're consuming alcohol.
Yes.
Because alcohol goes right into the blood system?
Well, if you're drinking alcohol, it's 20 to 30 minutes for the onset.
Okay.
But yeah, slower. Cannabis is definitely same route of administration, right? Oral administration, but much slower.
Okay. All right.
Yeah.
So, Wendy, if some of the listeners would like to get in touch with you or they'd like to take your class, how would they do that? So can you give them some pathway as to
that's great.
How they could get more from Wendy?
Yeah, for sure. I would love that. I love hearing from people, and I certainly love having students in my classes. I dig teaching. It's fun. Email me, right? And so my email address is on the City College website. You go to the directory, go to faculty, and my last name is spelled Wiehl, and you'll find my email address right there, and shoot me an email.
And I can say without a doubt, when I was planning this, I talked to the students from my class, and to each one, to the person, they said, you have to have Dr. Wiehl. She's got to be on the podcast. If she's not on the podcast, it's not going to happen. So I said, okay, settle down. We've got Wendy in.
Well, that warms my heart.
Well, listen, I want to thank you for coming and being part of this first few podcasts that we're having. And you're probably the best, most informed guest I'm going to have. I really appreciate you being here. And you're going to be in the class that's going to start at the end of this month, okay, October. And you're going to be in the class that I'm going to teach in the spring, which is going to be a double barrel shotgun.
Right.
It's going to be a huge class. Is that correct?
Yeah, cool.
I got you on tape now, so you can't back out.
I'm really honored that you asked me to be here with this amazing adventure, this new podcast. I think it's a beautiful thing. I'm very honored to be participating. And thank you for inviting me to your class as well. Your students are also little sponges. They're digging it too. Super passionate. So thanks a lot. I really enjoyed hanging out with you today.
You're welcome. And I'm going to call you back too, because you've got so much knowledge that I can't get it all in one podcast. But thank you very much, Wendy.
Thank you.
If you'd like to hear more Cannabis Enlightened with Dr. Leroy, be sure to visit us online at cannabisenlightened.com and subscribe wherever you download your podcasts. Cannabis Enlightened is produced in San Diego, California, and presented by March and Ash at marchandash.com. On behalf of Dr. Leroy, I'm Chris Cantori, and thank you for listening.
Today, everyone needs to think like an entrepreneur, whether it's in your own business, a large organization, or a nonprofit. I'm There For You, Baby. The Entrepreneur's Guide to the Galaxy celebrates entrepreneurs. You can find us on ivn.us or wherever you like to listen to your favorite podcast.